the term SACT. I don't know if you use SACT. It is used in some countries and not others, so I thought I would bring this here. It stands for Systemic Anti-Cancer Therapy, and this includes any medicines used for the treatment of cancer. So that includes chemotherapy, biological therapies, and targeted therapies. I also just wanted to give a background to SACT so that we're all aware of what I will be talking about. And SACT treatment has a narrow therapeutic index, so the level of treatment is close to the level of toxicity. It's given in pulses, it's complex dosing, it's given in regimens, in combinations, and aseptic reconstitution may be required. There's also the element of safe handling. So chemotherapy is mutagenic, so it causes changes to the structure of the gene. It is teratogenic and disturbs the growth of the fetus, and carcinogenic, so in itself can cause cancer. And so we need to take this into account for our staff as well as our patients. So the first thing I wanted to then discuss was, what is an oncology pharmacist? So this is a pharmacist who is trained in the area of oncology or cancer. There is no global standard, and it is not a protected title in most countries. In some countries, it's an emerging area of practice, and in others, it is well established. And this specific disease area for pharmacists has come about due to the complexity of treatment and the cost of the medicines, the potential for severe toxicities and medication errors, and the requirements for safe preparation, as I discussed in the last slide. So what does an oncology pharmacist actually do? So first and foremost, they will educate patients and family members. They can give tools to improve medication adherence with complicated regimens. They can help with drug interactions. They can anticipate toxicities and help patients manage their symptoms and side effects. And they can give advice on how to safely handle chemotherapy in the home. That's not all they do. They will help with supply, so they'll look at the cost-effective and appropriate procurement. They'll look at sterile preparation, reconstitution and delivery of the medicines, and help advise with spill and waste management. Clinically wise, they will ensure that the chemotherapy or the SACT order is safe and accurate and help prevent medication errors. And we call this prescription verification or clinical screening. They can give advice on clinical and medication related issues. And yet there's still more that an oncology pharmacist could do. And they could look at clinical governance with regards to the development of clinical guidelines, such as prevention and treatment of nausea and vomiting, policy and procedure development, and protocol development, writing or checking. They can also support and advise other healthcare professionals. They have a knowledge of legislation and licensing. They are the expert in cancer treatment and the supportive medicines. Now, that's an awful lot for an oncology pharmacist to do, and not all oncology pharmacists will do all of these items. Some are country specific, so some countries will do some of these areas and some won't, and some areas are defined by the requirements of the organisation or the availability of resources. But it's just to give you an idea of what an oncology pharmacist throughout the world can do. I'm just going to go off on a bit of a tangent and just talk about early detection. So this is where all pharmacists can be involved. So all pharmacists, regardless of whether they are oncology trained or not, can support our patients, public and friends to increase knowledge and awareness of why early detection of cancer is important. Now, in the next slide, I'm going to show you a graph. And this graph is taken from UK data. I could not find anything that could show, but it tells you what the trends are, and that's what I wanted to define. So when identified early, cancer is more likely to respond to treatment and can result in greater probability of survival with less morbidity, as well as less expensive treatment. And significant improvements can be made in the lives of cancer patients by detecting cancer early and avoiding delays in care where possible. So this graph shows here that if somebody is diagnosed with a stage 1 cancer, they have a 96% chance of survival at 10 years. So 96% of those patients diagnosed at stage 1 will be alive after 10 years. However, if somebody is diagnosed at stage 4, after 1 year, only 67% of people will be alive. And actually this drops to 11.6% at 10 years. So it's really imperative that our patients know that early detection is important. And early diagnosis consists of 3 components. So it's being aware of the symptoms of the different forms of cancer and the importance of seeking medical advice. They need access to clinical evaluation and diagnostic services, and they need a timely referral to treatment services. So early diagnostic of symptomatic cancers is relevant in all settings and the majority of cancers, and all pharmacists can help patients navigate the healthcare system in their country, as well as increase the awareness of seeking medical help early. So going back to oncology, so pharmacists who provide medication and pharmaceutical care to patients with cancer need to be equipped with the appropriate skills and competencies to ensure the safe use of these medicines. And this is where I'm going to start talking about ISOPP. So ISOPP is the International Society of Oncology Pharmacy Practitioners. And the mission of ISOPP is to advance oncology pharmacy care for patients around the world. ISOPP was incorporated in 1996 and is a not-for-profit organisation based in Canada. And it functions from the work of volunteers globally. And I am very pleased to say that on the 1st of January 2024, we moved from a payment structure to a no-fee membership. The ISOPP leadership team have done this because we want to be able to offer our education, our networking possibilities, and other resources that a global organisation has to everyone, regardless of financial situation. As well as preparing to move to the no fee at the beginning of this year, last year, ISOPP also launched our 10-year vision. Now, this is a very busy slide. I don't expect you to read it all, and it is available on our website. The vision was developed to give direction for the organisation for the next 10 years. Previously, ISOPP had worked off a 2-year strategic plan, and the move to a 10-year vision would allow leadership teams who come after me to have a long-term direction of ISOPP. But more importantly, it would give us the flexibility to look at larger goals that would take several years to mature, such as the global title of oncology pharmacist, where it would take several small steps to get to the final goal over several years, as can be seen. Now, work has already started on this with the global leaders, where we look to map out our current oncology pharmacy services across the world, and then we'll be looking at the education provision required for each of these services. We also wanted to work and collaborate with regional oncology pharmacy groups, of which you have one in Nigeria, regional pharmacy, and this is for where there are no oncology pharmacy groups. There are countries which do not have an oncology pharmacy group, and also work with international pharmacy or international global organisations to help forward our mission. The one thing I'm very passionate about is to not reinvent the wheel and utilise the great work already being done out there and bring it all together for the benefit of all oncology pharmacy professionals globally. Now, an example of where we have collaborated is the UTIC course. So UTIC is Understanding Targeted Therapies and Immunotherapies for Cancer, and this is an e-learning education program available for free as a member on our website. It consists of 5 topics, which are listed on the slide there, and there is 24 videos to watch. They're all about 6 to 8 minutes long, so you can just do one a day. And the quotes from people who have done the course have stated things like presents very complex information in a straightforward and engaging way, and the course is suitable for both new and seasoned practitioners. This is a clinical course, and it explains how targeted therapies and immunotherapies work, and it goes right back to basics. I've done the course myself and it's fantastic, and I would definitely recommend it. And did I mention it was free? The other thing we wanted to do was, and the other thing I wanted to further highlight was our other education program, which is OPAB. So last month, we relaunched our OPAB course, which is Oncology Pharmacotherapy and Applications of Biosimilars. Now, this was originally launched in 2021, but there was a fee to access this. This is now part of ISOPP membership, and so joining ISOPP for free, this is now available to you. The information is not completely up to date due to new medicines being licensed. However, it is still relevant to clinical practice. We also have other collaborations ongoing, and we will be having another e-learning program launching soon. There are some quotes here, and again, you can access this through our website on our education tab. Another education provision that ISOPP are offering, again, as part of our membership, so as no fee to you, is our webinar series. Our webinar series aims to deliver 1 clinical session a month, and then also either a research, a technical, or a work-based session such as leadership. Now, this comes from feedback received from the education survey sent out at the start of this year. The first or the next webinar, as you can see here, is highlights from COSA. So COSA is the Clinical Oncology Society of Australia, and at their annual meeting, they had some presentations, and there will be some feedback around that. So we're covering medicines and the microbiome, which is fascinating. Pharmacists prescribing from the UK. I'm unaware if you have pharmacist prescribers in Africa and Nigeria, but that could be quite interesting. This is again something that oncology pharmacists could do. And partnered chartering in Australia. So you're all welcome to attend that. Again, you can join for no fee, and there is more information on our website. So just going to go on to a little bit more information around ISOPP. So looking at our 10-year vision, we then broke this down into a 3-year strategy. This gives us immediate focus as a society for the next 3 years, and it helps our committees to focus on what ISOPP wishes to achieve and gives direction and leadership to the society. We've based this on previous ISOPP strategy structure to align with our past, but we wanted to update to include our current 10-year vision and therefore plan for the future. There were 4 key strategic initiatives to support our mission to advance oncology pharmacy care for patients throughout the world. The first one is engage our membership. Then empower the global oncology pharmacy community, facilitate professional development, and advocate for the advancement of oncology pharmacy. Now, the next slide is very busy. I don't expect you to read this. I am going to go into a little bit more detail for each of them, but this is available on our website. So looking at the first area of engage, if you look at 1.1, to increase opportunity for members to engage with ISOPP, we have a volunteer programme within ISOPP. We are a not-for-profit organisation which runs entirely from volunteers, and we have opened a form on our website for you to register if you are interested to help volunteer your time for ISOPP. We've also moved to improve our communication to members in 1.2, where we have moved to monthly newsletters, and you can sign up as a member and receive these for free. And we are also on social media channels such as X, previously known as Twitter, LinkedIn, Facebook, and Instagram. And these can all be found under the communication tab of our website. The next area of empowering, we have over 95 countries members of ISOPP, but we want to help more countries. And those that are not current members are potentially the ones that will need our support the most. So in 2.1, you can help us to spread the word of ISOPP by telling your colleagues and putting and informing them about us on your social media profiles. In 2.3, we're working towards the title of Oncology Pharmacist, as I pre-alluded to before, and a global equivalent to BCOP. Now, you may have heard of BCOP. This is Board Certified Oncology Pharmacist, and it is an American examination for oncology pharmacists. The examination is very American focused because it is an American exam, which makes complete sense, and we are working towards getting a title of oncology pharmacist and a global equivalent to the BCOP. In 2.4, we've set up a recent EDI task force, which is Equity, Diversity and Inclusion, and they are currently writing a position statement around EDI for ISOPP. And this is our first step to help our oncology pharmacy staff as well as our patients who are from minority backgrounds in whatever country they're resident in. Looking at developing our oncology pharmacy workforce, as in 3.1, we are increasing our education provision, as you can see by our online learning and our webinars that I've previously said. 3.4, we've got deliver outstanding regional symposia and masterclasses. So we could run, ISOPP could run regional masterclasses in Africa if countries are interested and there is an appetite. And in 3.3, we hold an international symposium every year. And then our next one is in 2025. It is in April and it is in Canada. You're all welcome to attend. Looking at 3.5, which is keep existing ISOPP publications and position statements current, I just wanted to highlight our standards of practice. So our standards of practice is to provide a benchmark to evaluate the quality of services and patient care. And these have been used as advocacy tools for pharmacists around the world in improving their cytotoxic handling and care for patients. An example of what is included in our standard of practice is on the screen, and there are actually 30 sections, the 30th being a glossary, so I did not include that, but you can see that there is a lot of information in these standards of practice, and they are available for free on the ISOPP website. There is also an audit tool on the website as well. Again, this is for free for members to use. Again, looking at 3.6, we have our Journal of Oncology Pharmacy Practice. This is a leading oncology pharmacy journal, and we are interested in reviewing new drugs or articles about cancer management and supportive care therapies, anything where oncology pharmacy may be involved in. And as a member of ISOPP, this is free for you to access. And if you are doing research, please submit to our journal. And here are some examples of what we have recently published in the journal on the screen. So looking at advocacy, so 4.1, we are working with the WHO on the essential medicines list. And we're also working with the WHO on defined daily doses, so DDD. And this is an assumed average maintenance dose per day for a drug. And it's used in research where they are undertaking drug utilisation studies across countries and globally. Looking at 4.2, this links to the work with the global leaders, as well as giving pharmacists education to learn about oncology. And an example of 4.3, we recently held a webinar on drug shortages, which had representation from all continents, and this was held a couple of weeks ago. The recording of our webinars and of this webinar and all past recordings of webinars are available for free to access on our website. Now, before I finish, I want to know what you need or want from a global oncology pharmacy organisation. So how can ISOPP help you to advance your practice for patients? As the new president to ISOPP, I took over in April this year. I really want to find out what ISOPP can do to help you. And you can either raise this now, or you can contact me afterwards. So thank you very much for your time.
Thank you very much, Netty, for such a robust presentation. Showing us what ISOPP is doing around the world and what they intend to do in your tenure for the next 3 years or 4 years. Congratulate you again for emerging as the ISOPP president. And as a hospital, we wish you the very best for your stay, successes, and that to be able to achieve all that you have outlined to achieve. So I'll leave the floor now for the president of the Oncology Pharmacy Practitioners in Nigeria. She'll be able to give us a brief on where we are, the oncology practice in Nigeria, and what their projections are for the next few years. So she'll have to moderate the Q&A session. Then we'll take questions from our assistants. Thank you. Good morning, everyone. My name is Francis, Professor John. I'm National Chairman of Oncology. We are so grateful for your presentation. Thank you so much for being here this morning. I appreciate what you are doing in the ISOPP. Considering the question you asked, at the end of your presentation, you said, what can ISOPP help? How can ISOPP help us to advance our practice in Nigeria and Africa in general? I want to say that ISOPP has already started helping us by new membership model. It's a new youth membership model, because this has actually given us access to the benefits, so much benefit that we get by joining ISOPP. On top of the list of what ISOPP has to offer is access to education. We talked about the meeting course that was recently launched. That course is so detailed and fantastically presented that all of us that have started in that course, the course has really helped us to understand targeted therapies in cancer. So I really want to appreciate you for giving us that opportunity to join ISOPP, because when we were paying the annual fees, it wasn't easy for some of us that are trying to join, for us to be paying the fee annually. So now that it's free, so many of us are taking opportunity given to us to join, to have access to educational materials and access to the Journal of Oncology Pharmacy Practice, and also the opportunity to network with professionals around the world, to be able to share our expertise and learn from what they are doing in other parts of the world, in order to be able to conquer our challenges and build our capacity. So we look forward to be able to participate more in ISOPP activities, especially the symposium that will be coming up sometime in Canada. We hope that people in Africa will be given the opportunity to attend. If we can get sponsorship to be able to attend such symposium, because our challenge is always funds. We won't be able to attend such symposium on our own without sponsorship. So we hope to be able to get sponsorship to be able to attend ISOPP symposiums. And we look forward to having such symposium in Africa. You know, we have the one in Kenya sometime. So we hope by very soon we have another one, probably in Nigeria, because we have a lot of oncology pharmacy practitioners in Nigeria. So we also hope that the plan of having a global certification in oncology pharmacy that ISOPP is pursuing the company very soon, so that's I'm looking forward to that. We also hope that very soon that ISOPP will be able to help us to see if we can attract clinical trials in oncology in Africa, because we have a lot of cancer patients in Africa, they will not have access to clinical trials. Because if you check most of the guidelines in cancer treatment, we always see where the patients are being encouraged to enroll in clinical trials. We don't have such opportunities there in Africa. Like Nigeria, we just have very few clinical trials. Those clinical trials that are going on in other parts of the world, extended to Africa too. Because of the genetic diversity we have in Africa, so we need to struggles to be carried on here in Africa. So thank you very much for this presentation. We will do a wonderful presentation. And thank you. So we can before we take questions from others.
So hello. It's the audio was not very clear and you came in and out. I'm not sure if my presentation was the same as well. Did you hear what I said clearly?
Yes, we can do.
Okay, so I picked up on some of what was said with regards to being able to access for no fee. That has been beneficial, and that you need support for sponsorship to be able to attend the Canadian symposium. I think that's what was said. It was rather unclear, unfortunately.
Yes, that's what I said.
So with regards to the sponsorship, I don't know if anyone has any. Yeah, I don't know if anyone has any questions or any statements. If they type it in the text, I'll be able to read that.
Yeah, there were a couple of questions that were asked in the registration form.
I can't hear anything now. It's gone completely.
Of the participants and asked about his name is Hello, can you hear me now?
I can hear somebody. Is that Victor?
Okay, so this is yeah, this is Victor speaking. Okay, so this is yeah, this is speaking. So I have a question from Azek Ayomide. Is a member of the Pharmaceutical Association of Nigerian Students. It says, how can I specialize in oncology as a student? It is my dream to be an oncology pharmacist.
So So with regards to oncology pharmacists, to become an oncology pharmacist, I suppose it depends on your background and where you are working as to what you need to do. There is no specific course, but what we would do in the UK is you would start working with cancer patients and shadow another pharmacist. If that's not possible, then start doing the courses within ISOPP, start reading around oncology and exposing yourself to the treatments that cancer patients require and need. Once we've done some more work around the global title of oncology pharmacist, we are looking to produce more education and training and potentially some more practical training as well. But this is not going to happen quickly. It's a long-term goal which requires a lot of work behind it and a lot of coordination with things, but that is something that we're aiming for the future. So get involved with oncology where you can.
Okay, let me come in here for those of us in Nigeria that are interested in it. Okay. I wanted to say that for those of us in Nigeria that are interested in specializing in oncology, as we all know, oncology pharmacy is a sub-specialization, so we have the cost of specializing in people pharmacy. For us in Nigeria, we started training in 2011 with support of companies like Roche, Sadoki, pharmacy, biospace, BPGH, even ISOPP supported us. So we've had so many trainings and trainings, but the good news is that the West African Postgraduate College of Pharmacy last year has started a fellowship program in oncology pharmacy.
So I heard from that it broke up so much. I actually don't know what was said. Sorry.
Yeah. Right.
Hello?
Yeah. Right.
Okay. So we hope to also keep the plan that ISOPP has in having a global board certification in oncology pharmacy when the time comes. And for now, we are still doing training and retraining of so many of our members to build our capacity and advance our practice. Thank you.
So I heard something around board certification. I was talking to somebody earlier this week around whether we can help get a board certification nearer to Nigeria, because I think the only place is South Africa at the moment. And there is a significant cost issue around getting people there to be able to do the exam. I will be talking to the BPS in the next 3 weeks to see whether this is feasible or not to help you. But the long-term goal will be able to have a global BCOP equivalent rather than the American one, because that's based on American licensing and American regulations. Whereas for a global title of oncology pharmacist and a global equivalent of BCOP, we would be removing around licensing specifically for countries. So it will be around more clinical and is this drug able to be used, or is there evidence for this drug to be used in this disease area, rather than is this drug licensed in that disease area, because it will be different for every country. I don't know if that answered your question. So somebody has put in the question. Wonderful. So there's a question of, I keep getting logged out of my ISOPP platform password. If you email me or email support@isopp.org, then
some of us were actually trying to answer. Interest. Okay. Okay, next, I think you're trying to answer the exam, like you said, about difficulty in looking into ISOPP network. Discover that the only center we have enough.
Hello.
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 I can
Can you
hear
hear me?
someone saying hello.
Hello, Netty, can you hear me?
I can hear you. Can you hear me?
Yes, I can hear you. Okay. Please, I don't know if you've answered the question concerning challenges in logging into ISOPP website that someone asked.
Yep. So if you can please email membership@isop.org and they will sort out the membership and how you access and make sure that you can get in.
A lot of people are actually complaining that they're finding it difficult to register to join ISOPP. I don't know what the problem is.
Yeah, there shouldn't be any problems to join. So let me share my screen again and I can show you. So this is the ISOPP website, and to join for no fee, you click join no fee here, and then you need to click this one here, which is click here to join for no fee, and then that will take you to a form that you just fill in, and if you're creating a new user, you put that here. If you're having any problems at all, you email these people here, and this is our Society Management Office, and they will be able to help with any problems that you've got and make sure that you are registered.
Okay, thank you so much. I don't know
If you
yes, yes.
So somebody has a question on whether chemotherapy is safe for pregnant women or not. And the answer is maybe. It's not normally given before 14 weeks or after 37 weeks, but depending on the risk of that cancer to the patient and the risk of the chemotherapy to that baby, that needs to be assessed clinically as to whether it is appropriate or not. So it's a very grey area as to whether chemotherapy is safe for pregnant women. Generally not before 14 weeks because the fetus is still developing. But once they've almost fully developed and they're just growing, then there is the potential that it may be suitable for that situation and that patient. So
I think that should be all for now.
there's a link.
So thanks, Netty, for the presentation. And thank you for all that ISOPP is set to do to advance practice in Nigeria, Africa, and other regions of the world. And also thank you for accepting to do this presentation and what you have said to do for us, what you volunteer to do for us as a hospital to help us. We appreciate your commitment to help our practice. And also thank you for privilege of access, where anyone can send you a mail, ask our questions, and get clarification in areas of practice. So we look forward to having you again sometime in the future. While we begin immediately with what we have learned to do. So we'll have a lot of corresponding emails to you, to ISOPP, and back and forth. Thank you so much. And thank you, everyone. We've officially come to the end of this 23rd series of the Oncology Journal Club. Thank you all for joining. And look forward to meeting you next month, same time, second Thursday of the month of July. Thank you so much. Bye for now.
Thank you very much for inviting me. Thank you.
Thank you, Netty. We are very grateful.
Thank you. No problems. Thank you.
No problem.